Hi, my name is Joachim and I've been photographing people with face tattoos for the past 5 years. I share the photos that I make on my Instagram. If you've never heard of me but you're interested in face tattoos and or photography, be sure to check it out. Besides photographing people, I try to do video interviews from time to time as well. A couple of years ago I did my interview with Musa, and more recently I did a more quick and dirty type of interview with Jeff Lambas. Both of them can be found on my channel. This time I really wanted to interview Kevin, or Kev Modpunk. I photographed him about half a year ago. Kev works as a nurse, and as you can see, he has tons of impressive tattoos and body modifications. I wanted to ask him about his transformation as well as the impact his tattoos have on his job. If you like these types of interviews, please feel free to like the video, maybe share it or subscribe to my channel. Thanks so much for listening and I hope you enjoy the interview.
My name is Kevin, Kev as I like to be called, on Instagram modpunk1 and 2. I'm 44 years old, almost 45. Beginning of October. I live in Holland, from the UK. I've lived here for 23 years and yeah, it's home. What I do for a living? Yeah, I've done many things for a living. I've trained many things, but at the moment I work as a qualified nurse, a registered nurse. But I'm not looking after patients anymore as I have done in the past. My job now on a daily basis is looking after the students, and from all different levels of education. They come to me for a bit of experience, work experience, and it's my job to make sure that they've got the right training and the right people in contact, and that they get to learn how to do the job. So I do a lot of office work, a lot of on-the-job work, a lot of hybrid work on the laptop and so forth. It's just a very variation of lots of things. I think when I first came to the Netherlands, about 20 years ago, I lived in the north of Holland, a little city called Hoorn. And in the village where I was living, there was a small private tattoo studio, and the tattoo artist was a biker. And I knew that I wanted for my birthday then a small tattoo. And at the time, tribal tattoos were really big and a hot item and a big trend. And so I knew that I wanted something along those lines. So I went and paid him a visit, just walked to the shop, and I asked him if he could do something. And he could, and my first tattoo was on my leg, and it was a tribal. You can't see it anymore because it's blacked out, it's covered up. And that was my first experience of getting a tattoo. After that I never anticipated in getting more. It wasn't in the planning, it wasn't oh, I'm going to do this. The influence and the motivation came very much from traveling abroad. After that I traveled a lot, mainly to Asian countries, and I was always interested in art and different cultures, and it was like a world went open for me. I realized, wow, this is fantastic. And that kind of brought me with different ideas and inspiration. And being back home, I did a lot of research on what I liked, what I didn't like, and being a bit of a creative person myself, I thought it was quite important. If you're going to put something on your own body for the rest of your life, you've got to be sure what you're doing. So a lot of homework, looking for the right kind of artists, and when I started with the Polynesian Marquesian style, in Holland, in the Netherlands, it was an up-and-coming trend. There was a lot of artists who were getting involved in the style. So the world, if you like, or the country was open to me. I was thinking, wow, that's really good, that's really good, that's really good. It started from there really. So I think that was about 7 years ago, 2013, 2014 was when it really actually begun. I went to Indonesia in 2014, and after that, that's when I really started to go heavy. I spent time in Indonesia and Nepal with the Buddhist monks, and I got very much inspired with Buddhism and spirituality and the earth and nature, and that was all again very much inspiration into transforming that into art. And I'm quite a quiet introvert person, and I think I was looking for a path or a vision of a destiny, and combining the creative skills that I've had. In England years ago I went to art school, so the creativity was already there. I think I was looking for something to combine a normal life, I have a normal life, but a conservative life, if you like, what people expect of you. I was trying to combine that with thinking out of the box and on what extreme levels to be happy and comfortable with my own life. And again, back to research, and I've said it before that with the social media and online, and that has helped me as well to progress in thinking and doing a lot of research, and you get a bit more confident. I didn't have a lot of confidence back then, so I think that's probably another reason why I went ahead and done it, because it's given me a lot of confidence self as person. And yeah, I much prefer this now than before. This part of the leg, the right part of the leg, was the next part after the tribal. And you can see here where it kind of stopped, just under the knee. And this is a piece which I said to the artist I wanted something which reflected the natural elements of the earth. And this part does exactly that. So you look at it, and there's, like, on the back there's a sea turtle. There's on the side here there's waves from the sea. There's here sails from the sailboat. Here on the side there's what they call whale teeth, hyatonder. This is all natural elements of the world, and especially in Polynesia. I don't know if you know much about the French Polynesia, but there are many islands in that part of the world, probably about 200 plus islands, and every island has got their own stammer, and each island's got their own style, and that's where it all comes from. But the style that really spoke to me a lot was the Marquesian style, because of the big black parts of the tattoo design, and you can see that reflecting in the large black spaces, and continuing here on my leg and the other large black spaces. You've got Samoan, and that's with a lot of detail, and I like detail, but I didn't like the style of the Samoan artwork, and so I just continued really. After my leg, this under part of the leg, I did a chest piece. I already had some letters on my chest, and I had that with color, with faint lines, and I had that lasered away. You can still see a little bit of the color here, but quite faint. And that was a cover-up, so it was just a chest piece. And I was really happy about that. And I think that's when it actually occurred to me, I'm starting to like this. I like the feel of this. And what was annoying me about that afterwards was the fact that I had white spaces on my body. And I'm thinking, oh, but it would look so much better if it was joined up. After my chest, this arm was done, the right arm, till just about there. This is an addition, and it was kind of joined up here. And then by different artists, I had this arm done and joined up here. And the same artist who did this arm did the sides and my back. My back is completely covered as well to my bum. There was never a plan to have a complete bodysuit, not at all. It was a gradual process, and at the same time I was learning about my own body. It is a given fact that a tattoo is painful, and anybody will tell you that, and that's no different with myself. But having known that fact, I was learning about how to deal with that pain on my own body. And there are some more painful areas than others, but that for me was part of the process of learning about your body, and I found it quite, how can I say that? I found that quite interesting to see how much a human body could take. With my medical knowledge as being a nurse, I was kind of pushing myself, using it as a sort of experiment. Okay, how far can I go? Some people will say that tattoos are an addiction. They're allowed to say that, but for me, I don't think it is. I think it's more of a trying to understand your own body and loving the artwork, because it's artwork, and trying to involve your personality at the same time. So you grow with that, and you start thinking about the different parts of your body and the different sessions and what you can do more, and that's how it kind of evolved and grew with me. The face was the last 2 years, so the last 2 years is my head and my face is completely covered. It was very much a test again. I wanted to see, I started something small here on the side, on both sides. And I had here what they call an unaloma, which is also something spiritual again. It's the path that you walk. I don't know if you know the symbol, but it's a symbol. And on the other side, I can't remember what I had there, but it was a test for me. Okay, what is the pain like? What does it feel like? What can I expect? So something quite small, and I think a lot of people do it that way. But again, it was for me. I proved to myself, no, I can deal with this. I like this. I like what I see. I like what's on my body. Thereafter, I thought, no, I'm gonna push this some more. I'm gonna continue with this. And I spoke to my tattoo artist about it. He was quite reluctant because it's not something he does on a daily basis, and even so, it's going to be on your face for the rest of your life, in your head, and something that could be quite frowned upon. But he agreed to do something, and we started with the chin. This piece on my chin was after my neck was the next piece on my face, and it continued from there. We kind of left it at that, and we went further with the head and joining the rest of the head with the neck, and that was done at several different stages, but quite intense because I was going every month to get tattooed and saving my money up. And yeah, if you're going to do it, it costs money, so you have to be prepared for that. Pretty much my head was completely done, I say about 8-9 months. Had a little break, and then we continued with the face. And that's when I thought, now I'm coming this far now, let's do it, let's go for it. You kind of see the reactions with work, with colleagues, on the street. It gives you a bit more confidence. You're feeling good within yourself. I'm at an age where I'm thinking, yeah, if I can't do it now, then when? I think if it was 20 years ago, I would have thought differently about it. But next part of my face was done the forehead, was the next part, and then the sides, and then the pieces over my cheeks, and the eyes. The eyes were already a little bit done because I had like eyeliner around the eyes, and that's covered now into big patches, if you like. I was worried that we looked like a panda, but that. Yeah, nobody's ever called me that. Nobody's ever been nasty about that. But again, it was more of the Marquesian artwork. If you look into the Marquesian artwork online, you can find many pictures from many Stammelingen that have got like different pieces on the face, and that could be like a strip, that could be like on one side. And I discussed with the tattoo artist Ivar, what could we do? And there was quite a bit of time that went over that because he was unsure, I was unsure. We knew we wanted to do something, but we wasn't sure what. And we came up with this. And at that time, my eyes themselves were already been blacked 2 years ago in October. So it was like the finishing touch, if you like, on my eyes. After that, my nose was the last part, and above my lip. But even that was an issue because I didn't want no straight lines, because I've got a big nose for myself, and I know that. And if you using shapes and different forms, you can accentuate profiles on your body. So there was a lot of discussion about what is the best to do, and we came up with this, and I was quite happy with what was on my nose, and that the form of the nose was used instead of the straight lines. And again, using the knowledge from the artist and from books and the internet, we came together and we designed this. It's never been done before. What I've got is unique to myself, gives me a lot of confidence again. I'm really happy. I much prefer all of this 10 times more than what it was before. I do get a lot of compliments. I'm very, very lucky that the door doesn't shut in my face. I've worked as a nurse doing care, home care, as I've come to people's houses to nurse them and looking like this. To me it's normal, but maybe to somebody else it's not normal, but that's okay. And the fact is that I can be myself and do my job with passion and come and care for somebody who's really, really ill. That is for me like an honor. And yeah, I believe that in life you all have your own path to follow and your destiny. And I believe that that's my destiny and my path. And brings me on to the next subject. I think that's quite important to teach that to the rest of the world. We all know there's many problems in the world, not just in the Netherlands and Europe, but across the world, with prejudices and taboos, acceptation, yeah, human rights. I can go on, there's many, many different themes and subjects. And I'm just a little part of that. I think it's important to educate the outside world and children, schools, that it's okay to be yourself as long as you are a good person. And that's what I do on a daily basis, even in my job. I get a lot of energy from it, I get a lot of conversation, I get a lot of positivity. And I think because of the way I talk and my voice, which I don't really like, but people often give me the feedback that I'm kind and I can relate to a lot of people, and that helps me to do my job. But at the same time, the acceptance is there because people have already started making conversation with you and they kind of see through the outside. So what they see, that's Kevin, that's him. And it usually becomes on a professional relationship, but a very good relationship. And I'm proud of that. Yeah. I can't say the period of the Corona period was the period that I did my head and my face. So it was a different kind of period anyway. And I can't really say that I had negative comments during that time, and not even now. So I've been really lucky, really, really lucky. I did expect it, but it hasn't happened. And yeah, I count my blessings. I think that's really good. The message I have is working. Yeah, people who were really ill during the Corona period, I've been able to nurse, and it's not been part of the question. It's not been part of the problem. I've just been able to do my work, and there's never been a comment to a colleague, oh, I don't want him, or no, it's always, no, send him, the one with the tattoos. So it's quite reverse of what you would expect. And even now, even to this day, those are the same comments that I hear. Yeah, you will always find somebody, you will always have somebody who doesn't like it, and they do say it's not my thing, but I respect you, and they're quite nice about it, but never in a negative way of to say something nasty to her that hurts me. That's not happened, so I'm quite lucky. Yeah. Came after the tattoos. We're very lucky in Europe that there are a lot of body modification artists who are traveling the world at the moment, not only in Europe but also America. And there's a massive trend for body modifications. You can see if you look online that it's getting really big, it's growing. But the problem with it is it's a lot of things are illegal, and you have to have special training to do certain things. And what you see is that body modification artists are trained piercers. They've got a lot of experience, but there's certain things that they do would be very much frowned upon, or you could get arrested or even sent to prison for. So a lot of things are done behind closed doors, and guest artists come to tattoo shops. They travel Europe and the world, and through networking and social media, and that's how they get their clients, and word of mouth. And that's how it started with me. Very much online, seeing traveling body modification artists, finding out who's good, who's not so good, and what you like and what you don't like, and doing your homework basically. And you see now a lot of body modification artists coming over from South America, Mexico, Brazil, Uruguay. They're coming to Europe because they have a family here, or I don't know, or friends, and they come and work here. And that's how they're doing it. I know in the UK, where I come from, it's hugely illegal. A few years ago, there was a big court case with body modification artists working in Wolverhampton in the Midlands, doing tongue splitting, purification of the tongue, which I also have. and he got sent to prison for that because it was seen as an mutilation of the body, which it in fact is. But it only has to go wrong with one person, and that one person then can take you to court, and that has blown up in the UK, out of proportion, if you like, become a big thing. So tongue purification in the UK is illegal, and that's just by one body modification. So I have a lot more, and that will probably, I know, is illegal as well. So I think I have the fact that I'm from the UK, but that I live here in Europe, is for me a plus point, because I know there are a lot of people in the UK who want to do it and who travel now to Europe because they get to see the artists as well. And that interest grew because I could see it on photos and what was possible. And I started to like certain things, and again through looking about how the body reacts in certain ways and what you can do on the body without causing yourself any harm. Yeah, it can always go wrong. There can be infections. That's always a risk you have to take. I did have here subdermals on my head on both sides, but the opening where the wound was wouldn't close, so I had to take it out. It doesn't cause me any pain, I could just take it out. But my medical knowledge again makes it that I can look after it after it's done, and I can keep an eye on it. I did have another subdermal here, I had 3, the same as here on 3, but this one, the proportion of the subdermal stuck out of my arm a little bit, so maybe the size wasn't quite right, and which resulted in that the opening where it was placed didn't join up properly. It had nothing to do with the stitching, nothing to do with that. It's the fact of the placement and how your body reacts to it and the skin. And that didn't want to close up because of the opening, and I kind of kept watching it after several weeks, giving it a chance and trying to help it, but it wouldn't. So I thought, okay, I've got to take it out. So I got a pair of tweezers, and I completely, with antiseptic, cleaned the area, and with a pair of tweezers I just took it out. I didn't feel a thing, no pain. I like the combination of everything that I've got. I get asked this quite a lot. I got asked this the same question the other day. I find it difficult to say one thing that I really, really like. I like everything that I've got. I don't think otherwise I wouldn't have done it. And with the perception, oh yeah, I wonder what it would look like if I have it there or something there. And you want to experiment with that idea. So you look into it and find out what you like, what you don't like, and I think that's how it goes. Yeah. And that's with everything I've got. I don't have no regrets. At the moment I'm very much continuing with the artwork on my body, making sure that I've just got a small bit here to do. This left leg is almost completed, and then we'll see after that. But you never know.
Everything in time.
Yeah, it's a process. I've been quite intense with that process because I've been every month been doing something, and I need to listen to my body and give it a chance to recuperate. And I'm starting to feel that now because I've gone so far. My body's not protesting, but you can feel the level of pain is different to the level of pain that I experienced in the beginning. And yeah, I think that's my way. My body is telling me, okay, you're doing a lot, calm down. So I need to take it slow the next few months.